Is bread in Europe better for you? This was the name of an article in New York Times earlier this week that I would like to comment on. So it's really important to understand that there are different types of sensitivity to wheat and gluten. Some people will have celiac disease, that's kind of top of the iceberg, and they should not be exposed to any gluten in any shape or form, whether it is in Europe, America, or some other part of the world. But there are also many different types of wheat sensitivity that have nothing to do with gluten and that are not celiac. And that is a little different category. Some people may have just digestive issues with gluten, and those people may actually really have easier time in Europe eating bread because it has a little bit less gluten, because it was reduced by fermentation, but it has less of another protein called ATI, Amylase-Trypsin Inhibitor. And that is actually the protein that many people may be sensitive to, and they think they are sensitive to gluten, but in fact they are sensitive to this ATI. And that is much lower in the type of wheat used in Europe, and it's further lowered by fermentation. However, it can still trigger inflammation. So sometimes the sensitivity to gluten or ATI or some other types of proteins in wheat they don't cause always digestive issues. Sometimes they mainly trigger inflammation by triggering the innate immune system. And that can happen at even quite small levels. So if inflammation is the reaction that you get from eating wheat and not digestive issues, you may still not get away with eating gluten in Europe. You think you are getting away because your belly doesn't hurt, but it can still trigger inflammation, and you may see the consequences later. So be careful. Understand what type of wheat sensitivity you have, and we can do all kinds of testing to determine that. And I hope this was helpful for you. I look forward to talking to you again. This is Dr. Tereza from InSpero Medical in Edwards, Colorado. Have a great day.